I'll thought I'll just give you a little more deeper dive. I believe most of you are from somewhere related background. So healthcare IT asset, you know how it is. So it can be broadly divided into, uh, uh, I would say, healthcare provider side is one, healthcare insurance side is one, and the other thing is the life sciences, which comes with pharma and the research and development side of it. So that is the life sciences part of it. So I am pretty much more aligned with the provider side, and insurance side is a separate domain as it is, and the life sciences also is a separate domain. So basically, healthcare IT systems, if you consider, it will fall across all of these three major, what do you say, sections of the healthcare. So if you consider, let's consider a routine hospital environment where patients come in. So there is an emergency side. Once the patient gets into the emergency, they might either go back uh, getting treated, or they may get hospitalized, that is, we call it the inpatient side of it. And or some people will be referred to a uh, for a consultation to a specific specialist. So it goes into a, like how we have a simple consultation on a daily basis, going to doctor, telling our problems, getting the prescription done, and coming out of it. That's an outpatient setup. So these are the three major areas where, but where our systems come into picture, it starts from the starting. So I don't know whether I can share. Let me see whether I can share something. This is the overall, if you see the picture where IT systems come and play their roles. For example, patient is at home. Patient, when they come into emergency, there is an emergency management system which is in place, which tracks what's happening with the patient and all those. You might have seen such things where somebody will sit and enter in the computers. So that is an emergency management system where they enter the patient details, and then gets into the, this is the provider space, where it is pretty much like the, as I said, let's take into consideration a hospital, right? So it will, hospital software which tracks down end to end what is happening in hospital from each department wise, nursing staffs, and how their schedules get aligned, everything, starting from the inventory side, supply chain management, everything all together, it is called the hospital information systems. Then we have the patient management system, which is called the EMR, this, and EHR, electronic medical record system or electronic health record system. So that is where we document all, anything and everything related to the patient. And then we have the clinical decision support. These are all support systems which are either standalone or plugged in with the main systems, which is clinical decision support system, which is basically used to help doctors provide recommendations. We'll come to that in detail. And then care management system. Care management is basically long term issue patients, like chronic issues, like for example diabetes. Patients have to be treated. And then telemedicine related softwares. So similarly, e-prescription modules. Practice management is basically a billing software. Then there is a prescription monitoring system, drug monitoring system, pharmacy information system, and there is prescription beneficiary manager. All this related to insurance. So, and there is lab information systems. There are radiology related information systems. Then a patient portal where the patient get to know what is the prescriptions and everything, and on a daily basis they can interact with the doctors. So, and there is a devices that comes into picture where nowadays, we can monitor our blood pressure, monitor our what do you say, blood sugars and everything, and that can be connected to the main system. And as and when there is a test done, or suppose you are testing your blood sugar, it will show up the value, and that gets processed into the system. So this is so an overall, this is where IT systems, this is a very high level description about where all IT systems can be plugged in. So it is in-house hospitals as well as outside patient monitoring and everything. And there are in areas where the research systems are also comes into picture, where we collect all the informations which are from individual hospitals. That is a data collection part of it, where the systems are designed to come out with inferences like they'll give the feeding of for tell me how many patients are within this particular zone, for example within this Bangalore, affected with uh, what do you say, let's take into consideration uh, COVID, like COVID affected individuals who have been already treated. So if it will have the database from all the systems, and the system has that intelligence, we will build that intelligence, and it will take all the diagnosis based on, so COVID diagnosis, and the treatment, it will have the prescriptions and everything, and it will identify those information, and it will give out of 100 patients, there are 80 patients that are completely recovered, and 20 patients out of 20, there are two patients did not make it, and the 18 patients are still under recovery. So it's like all of this kind of data, reporting data, the supporting systems will build. And similarly, this is not only with respect to that, the predictive modeling, where clinical decision support system is something like this, where artificial intelligence is brought into picture, where it will, based on the critical business rules, for example patient with an allergy to a medication, so that rule is already embedded within the system. We have created that rule, so whenever some doctor is prescribing that medication for that patient, immediately it'll throw an alert stating that you cannot prescribe this because the patient is allergic to the drug. So likewise, there are a lot of efficient predictive what do you say, business rules we can create.